Masood, I've just traveled from Pakistan and I was just so happy to see you here and share my views with you.
Well, thank you very much, madam. It's a really pleasure to sit with you today. I have been your student long ago and you were my examiner. And mashallah, you look so well. I'm
Thank
so pleased
you.
to know you.
I wanted to talk about the poverty situation in our parts of the world, which leads to so many health problems, as you're aware of, because you studied at Nishta and you're here now. My firm belief is that feminization of poverty is a global issue. Do you think it's prevalent in this United Kingdom as well?
To some extent, because particularly London is becoming very multi-ethnic.
Yes.
And as you could see, substantial population from Africa as well as subcontinent, and the same problems do prevail to some extent. Although efforts are being made to support these people, but deep-rooted cultural issues still persist, unfortunately.
Right. Do you believe that, like Pakistan, some areas of Britain also have that patriarchal society,
Uh,
leading to various health problems?
As far as I know, I think that it's getting less and less, but there are areas where there is dense ethnic populations, there are health problems substantially. For
Okay.
example, I can give you stuff this area, particularly Queen's Hospital where I work, and if I compare it to a purely white Caucasian area, the problems are way more in this area, complicated cases, late diagnosis of congenital abnormalities, etc. is quite prevalent.
In Pakistan, I have noticed when I come to England and I look at the people here, I have noticed that our societies are very male-biased societies, and our women are really deprived of so many things. To start with, we're not talking about the urban areas, but most of our population, as you know, lives in rural areas.
I would certainly know, because I come from a rural area of Pakistan originally,
Yes.
and I think it's still prevailing there.
Yes.
But fortunately in this country, things are very different, and the gender bias, particularly between difference, is very little.
Yes, and education is a big problem there. Although I have noticed that education is a compulsory subject here, but still there are a lot of biases which people carry from back home to here.
That's true. But once get onto the ladder, I'm pleased to say that even in London medical schools, the medical students, significant number comes from subcontinent India and Pakistan, and majority of them are females. And the females medical students or or students as a females, they are certainly outperforming males in this country at the moment. And very recent GCSE results has shown the same thing.
Right. In Pakistan, I have seen that the girls want to study. Even in the small villages, they want to study. But as children, they are more encouraged to do housework and to get involved with the different chores of the hospital, of the house, rather than towards the studies. Although studies are compulsory by the government, all the children should go to school, but the girls are not encouraged to go to school.
Yeah, that's reality. But this country, obviously, you'll have to send the child to school. Is if you don't, it's a sort of crime.
So the law is the same.
Law is the same, but implementation is really strict.
Yes.
For example, I mean, my son, he didn't go to school one day because he was not feeling very well, and he was with his mom and he got stopped. So why you're not at school? So things are very different as compared to Pakistan.
And have you noticed one thing here? Do the women come and ask you if there's any treatment to get a male child rather than a female?
Not to me particularly, because I don't do fertility as such, but I do get every now and then some overseas requests, as well as some people from here. And a very close friend and colleague of mine who does fertility, he has told me that a lot of requests are here as well.
To get a male baby?
Yeah, male child as compared to female child. And usually they come from subcontinent.
Subcontinent? Maybe Arab countries?
I'm not exposed to that much to Arab countries, but I'm sure they would be.
And in our parts of the world, you see every other patient who's pregnant would like to discuss what are the ways to get a male child, is there any treatment available, and they would like to know the gender of the baby. And the social setup is such that everybody wants to have a male child.
Yes, I think this particular interest is still persists in subcontinent origin population, which is here. I mean, even stuff when we had two sons, and my wife wanted a daughter actually. But when she spoke to her friends, and there were a few of her friends who said, "Oh yes, there are certain folk methods where traditional methods you can." If you get pregnant this part of the month or so, Chinese calendar and this and that, you can get the desired child. So one of my friends, he's a doctor actually, and she had two daughters and she wanted a son, and she showed very strong interest. So I think it's natural to have some sort of interest. But in this country, generally speaking, I have not come across particularly Caucasian people preferring for gender.
It's my belief that gender discrimination is a global problem, and every part of the world, I meet so many people in conferences from India, from China, from Arab countries, even from the developed world. They want to have the choice, to make a choice what gender baby they would like to have. I have asked this question many a times from many nationalities people.
Yes, that's true actually. I mean, if you look into the newspapers and everything, and because now the technology is becoming available, people want to have use of it, and to have I mean, it will be ideal to have desired gender child, as long as it's not abused. But that's the ethical dilemma. That when there is some technologies, for example, I mean, these anything you can use it usefully, or you can use it
Otherwise,
cause harm
yes,
to the people. So same is true. I mean, as long as this gender selection is used sensibly, I think there should be role, although it is social gender selection is illegal in this country, as I understand in Pakistan too. But I'm sure that there are people who are promoting that, unfortunately.
I have 3 girls, and when my youngest was born, the youngest girl, Rania, I actually shed a little tear. I wanted a son.
Yes, that's true actually. I mean, but I think it was sheer luck that my wife had a daughter when she wanted, but I don't think.
In our parts of the world, you see, where people are in the rural setups, male child is a very valuable person because he is the child who's going to work, who's going to probably bring home money, who will probably work in the fields. So this desire from a patriarchal society seems to be very genuine to those people.
It is genuine. I think it's historically looking at it as well, that I mean, when the original states, because the men, a lot of men got killed in the battles and all that, and there was some disproportion of the population usually, and this has got engraved into our societal minds to have a male child, and I think it will be very, very difficult to get.
I don't know if you've noticed, in Pakistan I have noticed that even some women, they are named their names sound like men's names, like Naeem Bibi or something like that. That's the male name, but they give it to the female child so that when they're talking about that child outside the house, nobody should know that this is a daughter and not a son.
Oh, right. No, I wasn't aware of that, but this is interesting relation to me.
Yes,
Must
I have
be
noticed that, and that I found that very interesting. I said, why are you called Naveed, or why you called Iqbal, or something like that?
Yeah.
And they would say, well, when my father calls out, he doesn't want to know that he's calling a daughter. Everybody should know that it's a boy. I was also talking to a Middle Eastern woman, and she said, I said, why would you like to have a son? And she said, we don't have a right to life. We don't have a right to name. We can't open a bank account unless we give a husband's name or a brother's name or father's name. Nobody asks my husband, what's your wife's name? But everybody asks me, what's your husband's name?
Exactly.
If I go for a bank account, or if I apply for a visa, if I apply for a driving license. So all these problems do exist basically.
But the question is that ethically, okay, should we give up to these problems and allow the gender selection? That's the big question.
It's unfair. I think it's cruel. And also it shows that we are inhumane towards each other. Is that
Exactly.
okay? So do you think gender selection is being done somewhere in the world?
I'm sure it is. I had a little flick through the literature and the things when I was coming over, and there are quite a few places, not in the UK, because it's illegal, who are advertising for gender selection. Now, I think it will be important that if you could shed some light on the various methods of gender selection, because the people who will be looking or watching us would like to know how accurate it is, how easy it is to do, and what sort of success rates we can look into.
I don't know what our audience is, but because we're going to be seen by so many people who are non-doctors, maybe family people, whenever people come with that request, and it's usually a man accompanying a woman who's his wife, comes to the clinic or to the hospital making that request. So I always ask them, do you know, there are, because in Pakistan and also some other parts of the world, the Muslim societies, they're allowed to have a number of wives. And I know of people who've had the wife produce 3 girls or 2 girls, and he gets married again, and he comes back, what should we do to have a male child? And I said, do you understand who's responsible for the male child? Is it your wife, or is it you yourself? Do you understand the mechanism of it, that it is the Y chromosome that you're going to give to your wife, and that is how the male baby is going to occur? And then when you have to explain all this to them on a piece of paper, that how fertility occurs and how a male child is probably the responsibility of the man himself. So it doesn't matter how many wives he changes, he is going to probably...
I think this is $1 million thing, that to tell the person, empower the woman to have this knowledge. It's not me who is producing a female child, it's you. So that will carry a lot of weight, I suppose. I think Pakistani women or Indian or subcontinent or even Middle Eastern should be informed about it.
If you look at the literature, we see that mammals produce the same number of sons or daughters, so as to say there is an equal ratio which nature has produced. There are only very few mammals, basically rodents and snakes and some deers, which have overcome this problem, and the ratio is slightly disturbed. But basically all mammals will have the same number of sons and daughters. So is it wise to change that situation?
I think it's not wise at all, because it will create a imbalance between the gender and can cause a lot of problems, really, particularly human beings, I suppose. And gender selection, but it's unfortunate that it's all so engraved that to overcome this one, we need a lot of education in the population, and maybe in future.
I've been talking to different people who deal with medical ethics and discussed this question a lot with them, and also to some religious scholars, and discussed it in detail, whether ethically is it right to do it or not. And the societies which govern, I'm sure like the GMC governs the medical practices in Britain, we have the Pakistan Medical Association, then we have our College of Physicians and Surgeons, from where we get our guidelines, and similarly we get guidelines from the Royal College of Gynecologists, and in America they have their own, and similarly all over the world they have their own societies and who give us the ethical guidelines. And the basic ethical guideline that we get from everywhere is that you should not do it. If you have to do it, it has to be a disease which is not curable, and there are some diseases which are X-linked or Y-linked, and which means that some diseases the boys will have and there are some diseases which the girls will have, and in those cases you are probably allowed in some societies and in some countries and in some states to go ahead and do the gender selection.
I mean, in the UK the law is very clear that gender selection for social reason is prohibited. So that's the very basic law. So all the process of gender selection should not be done. So and I would like to put a bit more of information if the people is that gender selection is not very easy process, and the ways the people do it is sperm sorting thing. These methods are not very convincingly 100% or success rate is variable depending upon. And the only more important surely would be if you're doing it, we call it as PGD, or where you do an IVF or test tube type of situation, take the embryo, determine the sex, and then implant into the woman. So that's a bit different. So it needs a lot of technology as well. And in those situations in the UK, if there is any genetic disease, for example, there are few hemophilia or this type of serious disease, it is allowed in the UK.
Yes, it is definitely allowed in the muscular dystrophies, in the Duchenne yes, hemophilia, and some others X-linked. Yes, this is allowed. But do you know that in some parts of the world, like to name a few, like China and India, they have been able to disproportionate the population in many parts of those countries, and there the ratio from a 50-50 has gone up to 130 males, and yes, it has happened, and that has been done through a process which is late abortions after determination of the sex on ultrasound scan.
It's very interesting. I was going through one of the articles where, you know, these even some people in states, what they're doing is they want to predetermine how our offspring should look like. For example, even they got egg donation from you know, these Caucasian girls. They want blue eyes, I want this color hair, and then egg donation, and then fertilize the sperm, and they send the embryo to India as a surrogate man, and there is a big trade going on, and then you get a desired stuff sex as well as the characteristics of the baby, for example, blue-eyed, blonde hair, whatever. And another interesting news was that these fertility clinics, they are offering money to Cambridge girls to to donate their eggs because they are very clever suppose. The Oxford girls
Really?
you have a very intelligent,
Very,
very intelligent child. So
Yes.
this technology is available, but I think it is a must that ethical rules or
guidelines must be
should
followed.
and applied to these things.
If you look at, it's a day and age of internet. When I was coming here and I would looked at my grandchildren, each one of has their computer and they're lying in each corner looking at the computer.
Exactly.
And so everybody is computer literate these days. So if you look onto the computer, you will find so many diets that people are propagating, that if you eat this, you're going to have a male baby or a female baby, or they propagate that if you have more proteins, more calories, then you will have a male baby. If you're a vegetarian and eat less calories and you eat less saturated fats, then probably you'll have a girl. So I don't know how far that is to
I think this is all anecdotal. I mean, because otherwise vegetarian people will have lots of girls, but I don't think that's true. Similarly, you know, as it says, Chinese calendar is very popular in this country.
Okay.
Yeah, they follow certain dates and this and that of the month, and they say. But again, it's just anecdotal evidence. There's no science behind that. I mean to say.
Also, there are a lot of clinics which promote douching and changing the environment of the vagina, saying that if you use vinegar and water douching, it becomes acidic environment and it promotes girls.
Yes,
And if you use baking soda and water and do the douches, it promotes, or it is a boy-friendly environment.
Yeah, the
And
theory behind that, as I know, is that Y chromosomes, they like alkaline medium, and the X chromosomes, they're more stronger, and they like acidic more, and they survive in the acidic medium more.
so the women are stronger, you agree?
Yes, they are, definitely. No question about that.
That's the better
Yes,
gender, you think?
Yeah, and also because Y chromosome is useless, as you know, it has little function anyway.
Yes, there are some species in which the only function the male has is to impregnate and die after that.
Yes. So same way, the Y chromosome only determines the sex and maybe one or two other things. As far as I know, the whole of the function is done by the X chromosome. Anyway.
Another technique, which is the American technique, the Erickson method of sperm sorting, in which the sperms are slightly structurally different, and through filtration and creating an environment, they do the filtration and produce sperm specimens in separate dishes, and then do an intrauterine insemination to produce a male or a female baby. Do you think that is ethical or illegal?
I mean, in this country, in the UK, definitely it is illegal.
Okay. Even the sperm sorting is illegal?
It is illegal, yes.
Yes,
You
okay.
can't do it.
Okay.
Basically, it's not something very, you know, these days we got cell separators and cell sorters, we call them, as it spins the semen in a very high frequency.
Yes.
And because the Y chromosome is small, so Y sperms are a bit lighter,
Yes.
so they separate due to centrifuge process.
Yeah.
And they have got separation rate. It is not guaranteed 100%, but it is.
Its success rate is quoted as 70%.
Yeah, so 70 to 80%.
Yes.
So, but that's the if you use, but the general population need to know that it's not natural. You'll have to have intrauterine insemination to with that.
Yes.
So.
Yes. So basically, the legality is the problem.
Legality in this country.
Yes, because we have to advise our patients on the legal issues before we tell them to jump into something. There are lots of couples that I was reading. There was a clinic in Turkey where they are giving very good results, but in the end they found out that this is not legal in Turkey to do it. So that's how they stopped themselves going there, because they didn't want to get into a legal problem. So basically it is not legal anywhere in the world except for a few centers and those are very few and can be seen on the net if people want to see that. The other thing that worries me most is the diagnosis of the sex on the ultrasound scan, and as the ultrasound scans are getting better and better and people are getting better and better trained, they're diagnosing the gender of the baby very early, and that is a big problem.
I mean, as such as you, I mean, when I was there in Pakistan, I'm sure that abortion is illegal there. Again, a abortion based on gender selection would be a big crime in the UK if it is practiced, and although social termination is allowed, but it is normally before you can determine sex for 12 weeks of pregnancy or less, and after that it becomes quite a bit of tricky to although if there are congenital abnormalities or certain special situations, it can be done, but not based on the gender of the baby. So in this country, UK, termination is allowed. Obviously there is a legal requirement that two doctors have to agree that this continuation of the pregnancy is
dangerous for the
mother or the baby, either psychologically or
well, that's a catch. That's a catch. The psychological part is a catch.
Exactly.
Because here any woman can say, I have 3 girls, if I have another one, I'm going to go mad.
Yes, that's true. So in this country it is legal to have an abortion up to 12 weeks, provided you can go to your doctor and he agrees and another doctor signs.
Yeah.
So 2 doctors have to sign a form to do that. And but practically, if you want, you can have it in this country.
In Pakistan, it's not legal to have an abortion. It's only legal only if it is less than 6 weeks, because according to the religion, when the ruh is not there, then in certain circumstances, if it's not safe for the mother, then she can have the abortion at that time, but definitely not for gender. And one wise thing some countries have done, which is one of them is India, that they have banned doctors from telling the sex of the baby to the mother, irrespective of what. They will not tell the sex of the baby to the mother. That is the law. And in China, again, there's a big problem, because there the family size is limited.
Exactly.
They cannot have a certain number of children. They will either have 1 child, or if they earn or pay so much tax, then they can have another one. So people want to have a male issue who can look after them, or leave a name behind, or something like that. So this is a problem, a real problem in some parts of the world.
I mean, I think it is historically taken, as you know, that infanticide, killing the female children, has been practiced even for a long time.
And you know how our religion was the one
who prohibited it.
Yes.
Very strictly.
Yes.
And but it was still practiced in some places. I think it's just the where they say when the people want to do something they could, and they do. And now that you got a scan where you can determine the sex a bit early, you do and have abortion. I think that again ethically, I think gender selection or legally is not right, and I strongly believe that it should not be done.
You know, before our religion, before our prophet, there were people who used to bury their girls alive.
Yes.
And there has been evidence that it was done, and then our religion came, and then we became civilized, and now we are going back to the same era where we want to kill our girls in some other way, which is not really right. And I don't think that should be encouraged at all.
I very strongly believe that, and I would endorse it.
But scientifically, PGD is there. It is there for those people who have a disease, in which if the disease is being carried through a boy or through a girl, that person can go ahead, have an IVF or an ICSI done, and then predetermine the sex of the baby, and then carry on with the male or a female child in which there is no disease. That scientific knowledge is present, and that is a good thing for many families.
Absolutely. I mean, obviously, this VGD screening is very, very useful to prevent even. It's now in the UK the law is, or you can have is, if the baby or the fetus has got congenital disease like cystic fibrosis or Down syndrome or muscular dystrophy, which can have serious impact on the fetus subsequent life, you are allowed to have termination or abortion throughout the pregnancy even.
Right.
But if you, because obviously these abortion procedures have got complications, as you very well know.
Yeah.
So if you can select an embryo which is healthy and doesn't carry a gene for a disease, it's a great breakthrough, and we should use it positively.
Yes.
It's like technology, you can use stuff, atomic power to destroy the cities or whatever, and you can use it for electricity generation or power generation. So it's the use of technology which is important. As such, the
Yes,
technology is
definitely.
very useful.
I agree with you. All over the world, I think if gender selection is to be done, it should be done for a reason. And the reason should not be to just kill a girl just because she is a girl.
And by any chance for boy as well. If
Yes,
you don't
of
want
course.
a boy.
Yes, yes. There are very, very, very few people who don't want a boy. Everybody loves a boy. I also wanted to ask you today about the maternal mortality in UK, because I was really disturbed to see that Pakistan, in spite of the amount of work that we go on and the amount of effort we put in with the laboring mothers and the amount of money that we spend on the health of the women, still our maternal mortality is very high, and the maternal mortality in Pakistan ranges from about 250 per 100,000 live births, and I was looking at Britain, that it is not really down to the bottom. I thought that it would be, but the three countries that come right to the bottom, where only 2 to 3 women have died per 100,000, is Singapore, Greece and Estonia. The British maternal mortality rate is somewhere at the 34th or 35th level in the world.
Yes. I think and the main reason for that, I mean, they are...
No, sorry, UK is 120th.
Yeah. So we are almost close to the Europe. We're not very different from them.
Yeah.
But I think...
about 12 per 100,000 last.
Yes. We do have very strong system of investigating, particularly, in your time it used to be called confidential inquiries.
Yes,
in maternal deaths.
yes.
Now it is changed into confidential inquiries in maternal deaths and perinatal mortality as well, such in babies as well. So every mother who dies during pregnancy or due to pregnancy is thoroughly investigated, and the recommendations come every 3 years. Major breakthroughs have been through blood transfusion and anesthetic improvements, but the reason we still have certain maternal deaths is if you see the breakdown of maternal deaths, at the top is pulmonary embolism,
Okay.
clot in the lung.
Yes.
Which is we hope that will come down, because we have implemented a new policy where we give heparin to even postnatal mothers
Yes.
after delivery.
Yes.
And I expect it will be lower in the next investigation. However, this is the top one.
Yes.
And then another thing which is more alarming is, the last investigation was infections in the mother during pregnancy or during the childbirth. And it is because of very resistant bugs, the bacteria.
Is it because of very resistant bugs, Or do you think it's the prolonged labor which is going on? The patients are put on epidurals and they're there for in labor with ruptured membranes for over 12 hours sometimes.
If you see the contribution of that, that is negligible, because sepsis, the mothers who died, some of them were antenatal, and only few were postnatal. So we are more of like GBS, group B streptococcus.
Yes.
That's one of them, and now some others as well.
Okay.
We lost, unfortunately, a mother a few years ago who was antenatal 32 weeks, no ruptured membranes, came in frank sepsis. And but in spite of delivery and everything, she had such a severe septicemia, she died. In spite of all the
antibiotics and all the care.
And everything. And very recently we have lost one mother, which is unfortunate, but the septicemia she had, she was resistant to even top antibiotic tazocine, which is, so she didn't respond and died.
In Pakistan, the greatest number of deaths occur due to three major delays. It's delay in diagnosing that there is a problem with the mother. Then there is delay in transport, getting the mother to the hospital. And then the third delay is at the hospital. The resources are not that much that she is treated properly. And most of the deaths which occur in Pakistan are due to blood loss. And the basic problem is that nobody wants to give blood to their wives. There is a myth amongst many men that if you give blood to your wife, she becomes your sister. Is that a problem?
No. In this country, current situation is that there is no blood donation from a relative. No. So even if I want to give blood to my sister or mother, I can't give blood, because blood is given through donation and is processed, and because of the shortage of blood donation and needs, obviously, the blood is processed into PET cells. If somebody's like low hemoglobin, they will get just hemoglobin, red blood cells, and if somebody needs platelets or plasma separately, so blood is stored separately, and it needs a lot of time to screen it for infection, for example, HIV, hepatitis, etc. So trajectory or blood transfusions, whole blood is almost non-existent.
Oh, that's the reason here is because your females in Britain, their hemoglobin levels are much better than ours. Here, if you see a woman with a 9 hemoglobin or a 10 gram hemoglobin, you will say she's anemic. Well, in Pakistan, if we see a 9 or 10, we would say, oh, well, she's all right. Because you see a lot of anemia, pre-existent anemia, when they come to the hospital, they are very anemic. And on top of that, when they bleed, the hemoglobin further drops. On top of that, if there is a complication and she needs to have surgery, or she has got a ruptured uterus or something like that, then you need massive amounts of blood, which is not usually available. So that is a real problem, that women are dying of hemorrhage all the time. The second cause of death in Pakistan is infection, and the third are related to medical disorders like hypertension, eclampsia, and other medical disorders.
How common is eclampsia there?
Eclampsia is very common, and women usually present at a very late stage. When they are actually fitting, they are brought to the hospital. And as for the viewers who don't know about what eclampsia is, that it is a disease related to pregnancy, in which women have very high blood pressures. They're starting to throw up protein in their urine, and there are microcoagulation going on in their body, and they are having little microinfarcts in the brain, and they are having fits. And it is a life-threatening disease unless you can control the fits, control the blood pressure, deliver the baby, and monitor the mother. It's a real big problem. And there are certain seasons during the summertime you see more eclampsia, and your wards are really full of these laboring patients who are throwing fits.
Very sad, unfortunately, that you can't get them that early. Now going to another topic, which I think is certainly very controversial, is contraception in Pakistan. And because I was just thinking about it, that such a high maternal mortality and obviously infant mortality over there, and the population explosion. Is there anything which can be done without any controversy there? You have been very experienced and martial, a very learned professor there.
The problem is, you see, sometimes we try to sweep the problems under the carpet, and then we pretend that they do not exist. Young people all over the world are the same. Boys will be boys and girls will be girls, and pregnancy will be pregnancy. So there is a definite need for contraceptive advice, at least awareness and availability of contraception to the young people. Now the problem is that we pretend and we believe that extramarital sex does not exist, but it does. The second thing is that even people who are married and are getting pregnant, they also need contraception very dearly, and the contraception is available. It is available and accessible to the people who really don't need it. The educated people, the urban people, they can walk up to any store, buy contraceptives, they can use contraceptives, they are aware of contraceptives. Availability is not a problem. There is no law that contraceptives cannot be bought. But the problem is the rural areas, where contraception is a real requirement, where the women are not empowered enough to control their fertility. They have to depend on their mother-in-law, on their family, on their husband, on their religious views to practice. The question is, to be or not to be is not the question. The question is whether they can be pregnant or not be pregnant. They cannot make the decision themselves. Somebody else has to make the decision, and when it is somebody who is not directly affected, will make the wrong decision.
Well, I personally feel that, this is very important, that in Pakistan particularly, the population planning should be just the priority of the government.
It is a priority for the government. There are many non-government organizations from all over the world who are helping and giving contraceptives on a very economical and low price. But the people who really need it, who have bigger families, they do not practice contraception effectively for many reasons. One reason is that the infant mortality and the neonatal mortality is so high that they know out of their 10 children, at least 4 or 5 are going to die. So that is one problem. The second is sometimes the desire to have a male child. They go on producing more children. And thirdly, their religious views or their family or social views are such that they will not use the family planning or the contraceptives effectively. And the fourth is that they do not understand how the contraceptive works. So if they are taking the contraceptive pill, probably they are not going to take it properly. If they are going to take the morning after pill, they are not going to take it properly. Or even if they are using the condom, or if they are using the IUCD, they are not using it properly. So that is why probably there is a problem.
What I get is that there is a big need to educate the population there and provide them the right knowledge.
Well, I have seen that when you talk to women, they understand, they want to. But the education and the knowledge has to be imparted to the men. And there must be a medium where the men of our country need to be educated. They need to be told what is good for them, what is good to, why is it good to have a smaller family, why is it good to have education, why is it good to stay healthy, what should be the right eating patterns, and if they have smaller families, how they are going to progress. So just by showing a small family on the television, because television is a big medium now, even in the rural areas, the people may not have anything else, but they will have a television. So it's the government's responsibility to show movies, or to show dramas, or to show advertisements which are more eye-catching to the rural population.
Maybe like bring into the soaps, like, you know, dramas and all
Yes,
that.
and also because people listen a lot to our religious leaders in the rural areas. The religious area is very strong. So if we are able to convince the local imam to talk to their men, then probably it will be more effective.
I think, I mean, I personally feel there's a great need for that.
Yes, definitely.
In this country, I mean, obviously, it is quite liberal in the sense, and even for the contraceptive, it's just freely available, people practice it, and even for the teenage girls, it is now, I mean,
Yes.
you can give it, you can go over the counter and get, you know, stuff pill if you want
Yes.
to.
The health education is not a big priority in our parts of the world yet. The reason is that we are dealing with so much emergency work, like a 100-bedded maternity ward is receiving more than 300 or 400 patients at a given time. So, and where the delivery rate is something like 15,000 per year or something like that, with limited amount of facilities, they are just doing the routine work.
Exactly,
Day-to-day work is
firefighting
so,
actually,
yes, it's so
firefighting,
much
yeah.
that you don't have time to counsel people. There should be a separate, totally separate group of people who should be doing that.
Yeah, but obviously, if you could sort of bring the birth rate down, the pressure on the acute hospital will be
Much
reduced
less.
as well. Yeah.
Yes, I definitely believe that.
Shahnaz, it's really nice to talk to you and get to know what is happening in Pakistan at this stage, and also insight into the gender selection and perceptions of the people and the law. And I think this will be very useful for our viewers who would like to get, and I'm sure there will be link or information available if somebody wants to know about it. And I would like to thank you to come and talk to me today.
Dr. Vasu, thank you very much, and you know, it has been a great experience to be here and to look at my own subject from a different point of view. I firmly believe that we are trying our best. We have the facilities, we have the know-how, we have the energy, we have the desire to do the things, but the problem is so immense and our resources are limited, and we are trying so hard, but there are problems like illiteracy, problem like nutrition, healthy water, birth spacing, issues of the girl child, early marriages, lack of knowledge about contraception, and then the desire to have a baby boy, and then the perils of infections due to unsafe abortions. It's really a troubled part of the world, and it is always enlightening to look at people who are suffering less than you are.
I'm sure, I mean, I think the message would be that if you educate your
Yes.
women, and you will get a healthy nation.
I think educate the men
Men as well.
to get a very healthy
I think,
nation,
I
yes.
think if the women are educated as child, male child, a boy, a son, they will educate them to the right direction.
Yes, I'm sure. Thank you very much.